Good morning, everyone. I would like to say thank you for seeing in my presentation. Let me introduce myself. I am Sekar Arum Sayekti, and I am from Universitas Indonesia. In this opportunity, I would like to present our paper about impact analysis of the enforcement of limitation on community activities policy implementation in DKI Jakarta. This is part introduction. DKI Jakarta is the province with the highest population density in Indonesia. This condition causes a high risk of COVID-19 transmission in DKI Jakarta. This concern is in line with the research conducted by Tiara et al. 2021 entitled Analysis of the Relationship Between Population Density and the Pattern of Spread of COVID-19 in DKI Jakarta province using robust regulation. In January 2021, the number of positive COVID-19 cases in Indonesia reached more than 800,000 cases. With the high number of cases, a policy for the enforcement of limitation on community activities was established, which is regulated in the Instruction of Ministry Home Affairs Number 1 2021. The Governor of DKI Jakarta followed up on the minister instruction by announcing the implementation of ECLA. The research method used in this study is a qualitative descriptive method by exploring the impact of policy implementation from the aspect of policy output, target group compliance, and the real impact of the policy. The study used a top-down model approach. The model is carried out using the framework of Sabatier and Masmanian ideas, which generally explain the variable of the implementation process of a policy. There are 5 stages of the policy implementation process that are used as the dependent variable. Normally, 1 policy output from implementing agency, 2 target group compliance, 3 the real impact of the policy for perception of this impact, and 5 evaluation of the political system in the form of efforts required. Since this research focus on the actual impact of implementing policy, it is sufficient to examine the 3 initial stages, namely policy output. In analyzing policy output, data was collected from policies that were passed and their progress from January to March 2021. To measure target group compliance using secondary data from the National Survey of the COVID-19 Outbreak, 28 February to 8 March 2021 by Saiful Research and Consulting. The real impact of the policy can be seen through a decrease in positive cases, a decrease in death cases, and an increase in the recovery rate. This is result and discussion for policy output. The government of DKI Jakarta province support every best regulation from national government in managing COVID-19 pandemic in Indonesia. This is a regulation related to COVID-19 pandemic mitigation and preparedness from both national government and DKI Jakarta provincial government. This is part target group compliance, awareness and attitude behavior micro PPKM. The survey result on the awareness and behavior toward micro PPKM show that 52% of the respondents are aware of government effort to minimize COVID-19 pandemic through PPKM in several areas of Java and Bali. On the other hand, the awareness of respondents living in Java and Bali about micro PPKM are about 64. This is a effectiveness of micro PPKM in minimizing the spread of COVID-19. There are 71 of respondents who are aware of micro PPKM claim that this effort has very significant impact and average impact on minimizing the spread of COVID-19. On the other hand, the 68% of residents who are living in Java and Bali that claim that this effort has very significant impact and average impact. If given to choice between implementing micro PPKM significantly, regardless the grouping of income, or stopping micro PPKM, which will evidently increase the risk of COVID-19, people living in Java and Bali are divided into these two groups. There are 44% of them who decide to implementing micro PPKM. On the other hand, the 46% choose to stopping micro PPKM. Further, the noticeable impact of PPKM could be seen from the escalation of positive cases, which are not really significant. The increase of recovery rate overweights the escalation of positive cases, but the death rates are still high. And the conclusion, PPKM policy has been going and implemented well in DKI Jakarta. Ultimately, the implementation of PPKM in Indonesia, particularly in DKI Jakarta, are effective enough in minimizing the spread of COVID-19 pandemic in Jakarta. PPKM policy will be more effective if the consistent from the community and also central government as well as the DKI Jakarta government is well maintained. Following the reference from our paper, so many presentation from me. Thank you.